Hi, I'm Katie Johnson, health educator at Mayo Clinic Health System. While we all experience grief and sadness at some point in our lives, did you know that an estimated 10% of the U.S. population suffers from some type of depression? That's a lot of people who are struggling. Joining me now is psychotherapist Dan Lynch with Mayo Clinic Health System. Dan, can you help me understand a little bit more about depression?
Well, first off, depression is the most common mental health condition. And so if you are experiencing depression, you're clearly not alone. Typical symptoms of depression include low mood, negativity, feelings of hopelessness, being tired and having less energy, social withdrawal, and low self-regard. A more serious symptom is having thoughts of self-harm or suicide. So if you or a loved one has thoughts of this nature, professional help is needed.
Nobody should have to live like this. What should someone do if they think they have depression?
Well, there's generally two courses that a person can take in terms of experiencing depression, how to respond to that. One path is geared towards self-help, which is more appropriate for a mild depression, or even as a means to prevent depression. This would involve lifestyle adjustments such as getting enough sleep, maintaining a healthy diet, exercising each day, preferably 20 minutes a day. Even a daily supplement of vitamin D may also be helpful, especially during the winter months. Another important aspect of self-help is keeping our thoughts balanced rather than having too many negative thoughts. I think sometimes we don't realize how much our thoughts can affect our mood. For people who are experiencing severe or chronic depression, more immediate professional help is warranted, especially if thoughts of self-harm or suicide are present. Treatment options for more severe or chronic depression include individual therapy, group therapy, and/or medication. If someone is experiencing suicidal thoughts or even thoughts of self-harm, it's very important to get help. And one could get help through either calling a national suicide line or simply calling 911. Depression is nothing to be ashamed of. As we talked about, it's one of the most common mental health conditions. And on a hopeful note, it's very treatable. So when we look at treating depression, we should look at treating it as we would treat other medical conditions such as diabetes.
I really hope the information that you've shared will help someone today. If you or someone you know may be dealing with depression, help is available. It's a condition that can often be treated or effectively managed. We encourage you to seek more information at mayoclinichealthsystem.org or the resource on your screen.